Hey guys, my name is Amanda and I'm going to be talking to you guys about my FAI journey. So I'm going to talk about my FAI journey and I will put on the screen the correct term for it. It's a longer word that I don't exactly know how to say exactly. So it will just be better for me to just put it on here and it's a definition of what it is. But I have FAI and I tore my labrum as well, and the labrum is basically a rubber seal around the hip joint and it cushions that socket. So I also will put a definition of exactly what that does and what it means to tear it, but basically I have FAI and I tore my labrum. So I didn't notice this pain until around September and October of 2019, after I had been weightlifting and working out a lot for a year or so prior. I was working out and I noticed pain in my hip and I thought I was just tight. I thought I was strained something in my hip flexor potentially. So I didn't think anything of it. I just kind of brushed it off. I stretched it. I took a few days off of working out because I didn't want to continue to push my body if it was hurting, so I didn't. But it just got worse. I noticed it getting worse. I noticed more pain. So I went to my family doctor and they prescribed me an anti-inflammatory, which definitely helped. It was definitely inflamed and it definitely needed rest and this anti-inflammatory. But they also recommended I go to physical therapy. So I went to physical therapy and I went for about 6 weeks. And during that 6 weeks, I did a lot of hip strengthening things. So I did glute bridges, I did lying leg lifts, I did like lateral walks with a band on my hips, on my knees, stuff like that that strengthen your glutes and the muscles surrounding your hip. And at the time, I really was invested in it. I wanted to get better. I was like, I enjoy working out. I want to do what I have to do to help my body. But these exercises were just aggravating my hip pain more than it were helping. So I remember telling my PT that, and they basically thought that I had what was called FAI. And so I had never heard of FAI. I was really confused about what FAI even was. So, sorry, I'm just gonna fix this. So I basically had to go home and I was so confused and I didn't understand what they were telling me, because they told me this FAI thing requires surgery because if you have FAI, you most likely have tore your labrum. And I didn't know any of this. I didn't understand it, and they told me I would need surgery to help repair it and be able to get back to physical activity at a level that didn't cause pain, which I 100% wanted. I didn't want to have pain when I worked out. I love working out. I'm young, so I want to still continue to be able to work out. I don't want to have this pain. And they suggested surgery, so I reached out to the surgeon that they recommended for me. And at the time, I was really upset. I wanted to continue to work out and I wanted to continue to be active and stuff like that, but I couldn't because of the pain that it caused me. But I just remember knowing like I had to get surgery and that scared me, and knowing that I would have to like recover, and it was like a longer process than a few weeks. It was like the recovery process is like 4 to 6 months, and that was so scary to me. I was like, this is crazy. I just was trying to lose weight. Like I didn't know that I was gonna tear something and have this condition. So I remember crying about it. I remember calling my mom. I'm like, Mom, I gotta go to surgery. I was crying and it was sad, but I'm like the type of person, like I'm motivated. I want to fix myself. Like if I'm hurt, I want to fix it. If I'm sick, I want to get better. So they told me I needed surgery. They told me that was the best thing for this condition. I mean, maybe not for other people. It might not be. A lot of people don't want to get surgery. A lot of people think it's a lot of trauma to your body and it can be devastating and it cannot work sometimes. So a lot of people don't want to get surgery, which is totally fine. You do not have to get surgery. But for my personal preference, I thought and I contemplated going back to work. I was like, do I need it? Do I really want to do this? Do I really think I need surgery? But in the end, I made that decision to go through with it, and it went okay. I think it's going well for me. I'm 5 months post-op today. So I went to the doctor, the surgeon doctor, and I had x-rays, MRIs, all that good stuff. And they basically said I was a perfect candidate for the surgery. They said everything was wrong, that it was wrong, that the physical therapy people thought was wrong. So I scheduled for surgery. I actually scheduled for May, but that had to get postponed due to COVID and everything. So I had it at the end of June, on June 25th. And surgery was scary for me. This was my very first ever surgery. I never had anything done besides like my wisdom teeth, and that's not even like full on going through anesthesia. It's just like a twilight thing. So I was really nervous about the anesthesia, but they gave me a nerve block, and after they gave me this nerve block on my hip, I don't remember anything. The last thing I remember is just like waking up and then being like, okay, yeah, how are you doing? Do you want graham crackers or goldfish? Like randomly. And I was like, goldfish, duh, like obviously. But I had my goldfish. I had like a cough from the tube down my throat, which was really annoying. I was okay and it went fine. That was 5 weeks ago. And the first week or two, I was really tired, but I know that's from the anesthesia and everything. So I took like a nap maybe every day for like a week and a half because of how exhausted I was. And I don't even take naps. I really don't. I'm not a napper. I don't like naps really because I'm like, why would I need to take a nap? It's the middle of the day. I can just wait till night and go to sleep early. It's fine. But this was nothing like that. It was like I had to take a nap. I was like too exhausted. So I took a lot of naps that week. I wasn't in a ton of pain really. The nerve block really suppresses like all that pain that you would have. And that for me, I don't know how normal this was for me, but it did last in my leg. Like basically my hip and upper thigh had like some tingling in it after it started to wear off, but I really didn't have a lot of pain for like a week or up to like 3 weeks. I didn't have pain. Like enough pain to be like, I need a pain pill. Like I think I took 1 or 2 just that first like day and night and stuff, but I did notice tingling through my leg after a few days, and I just know that was because it was wearing off and that nerve block was coming off of my body. But I did still have like a little bit of numbness and tingling for like 3 weeks, and they said that was fine. It obviously went away now, so, but yeah, I didn't have a lot of pain. The only pain I had was if I lifted my leg. So if I lifted my leg into the car, or I lifted my leg onto the couch or the bed, I noticed a lot of pain through my hip flexor. But you're not supposed to lift your leg, and I didn't know. So I basically had to stop doing that. I had to stop lifting my leg. I had to stop doing any of that stuff. I just had someone else lift it for me. So I never lifted it. If I was a physical therapy, they lifted it for me. But yeah, and you don't want to lift it because that can cause hip flexor tendonitis, and you don't want that because that just causes a delay in your recovery. So I didn't do any of that stuff. I just kind of chilled. But now 5 weeks post-op, I can lift my leg fine. I can get into the bed fine. I can do everything without pain. I think just the first few weeks you want to be careful. I stopped using crutches about 2 weeks in. 2 weeks in I moved to 1 crutch. So I was just using 1 crutch at 2 weeks. A lot of people stay on crutches for a longer time. My surgeon's protocol didn't call for me to stay on crutches for that long. I know a lot of people can stay on them from like 6 weeks, which is crazy to me. I don't know why, but from the moment I got out of surgery, I was already 50% weight bearing, which I think helped. I had 2 crutches for 2 weeks. Then I moved to 1 crutch at 2 weeks, exactly. And then a few days later, I completely had no crutches. So I was off crutches completely at 2.5 weeks. And I had a little bit of a limp for those 2 weeks, for like 2 weeks after that. I would say today at 5 weeks post-op, I can walk without a limp. I still do have a lot of pain kind of in my quad, just soreness really. Just my PT told me that the scar tissue that I have that I didn't massage enough, I'm starting to massage it now with a massage gun, but that can cause a lot of soreness down your thigh and in that area. So that's really where I notice the most pain. And it's not like a pain, it's not the same kind of pain. It's like a soreness, and it's in the front of my thigh. And I know it is from the scar tissue because that's exactly where my scars are. So I have a massage gun that I got for Christmas that I've been massaging it around a lot through my whole thigh, and it's been helping. It helps loosen everything up. I do a lot of stretches, so I stretch the quad daily. I have to because it gets so tight. But yeah, you gotta stretch. Like once you get past like 4 weeks, start stretching, like a lot of stretching. Don't overdo it, obviously, because you don't want to do anything to damage it, but most of the things that you can do won't. So I constantly am asking my PT questions. I'm constantly getting information from them because that's what they're there for. They know this stuff, and it's better to ask someone that knows. So just highly recommend just talking to your PT because they know what your surgeon wants you to do, because they're in communication usually, and it's just for the best. So I was able to get off crutches and do these stretches sooner, but I think everyone should start stretching around 4 weeks. Anyway, I'm doing really well at 5 weeks post-op. I'm going to continue to make update videos and give you guys information about how I'm doing, but so far I'm glad I got the surgery. I feel confident that it did work. Obviously I won't know for sure for a few more months. It's hard for me during this recovery because I am used to being active. I was active for a year straight. I did sports in high school. I always went on like hikes and stuff for the most part of my life. So this stuff is different, just sitting around and watching a lot of TV. I mean, I'm not complaining because it is fun to an extent, like hanging out at home. So I don't mind, but it is different because I'm used to being able to work out and everything, but I'm trying to just take it slow. And I just want to continue to make videos because I just feel like there's not a lot of information out there about the recovery process. There is a lot of information about the surgery and if it may work and everything, but there's not a lot of people talking about how well they did with recovery. So I'm gonna just go ahead and give my 2 cents and hopefully it helps others. But I hope you guys like this video. I hope you can take it and learn, and maybe if you're thinking about having surgery, this helps you, and if you already had surgery, we can go through this together. So yeah, if you guys have any other questions, comment them below, come up with ideas. I don't know, I'm gonna continue to do it, so I just rather do stuff that you guys want. So yeah, hope you guys have a great day, and thanks for watching. Bye.